Well, this is obviously, it is alarming. Not so much the cases we're having in the UK, but this reflects the situation in Germany. They are seeing an unprecedented outbreak there of this unusual organism affecting a population which you wouldn't normally expect to be affected by hemolytic uremic syndrome, which is the serious consequences of infection.
But people, it's important to stress, aren't catching it here in the UK
no,
so far,
absolutely not. There is no evidence the source of this infection is in UK. All cases we have had, and indeed in other European countries, all are associated with travel to Germany.
One of the things that's very striking about this infection is the number of people who are developing the kidney complications, HUS as it's called, and the fact that a lot of them are adults. Why do you think that is?
Well, this is the strange thing about this outbreak. It's very unusual for adults to have HUS syndrome anyway. It mainly affects young children and older adults. But what we're seeing is predominantly young females getting this condition. It's a very rare organism that's causing this, and it's thought it has particular properties where the toxin it produces is particularly virulent and therefore is affecting this population more than we would normally expect.
For anybody who's been to Germany and who's worried, what's the advice in terms of seeing their doctor?
We're advising anyone who's been to Germany and has symptoms, and that's of bloody diarrhea or other things which they may be concerned about, if they have been to Germany, they should seek urgent medical attention. The medical practitioners in England have been briefed that this situation is going on and how important it is to report and investigate these cases promptly.
So far, there's no indication of what the source in Germany is of this infection. How much of a concern is that here in the UK and to health officials in other parts of Europe?
Well, the Robert Koch Institute have done epidemiological studies which found that cases were more likely to have consumed tomatoes, leafy salads and cucumbers, and therefore they are sampling these foods exhaustively. But that is epidemiological findings. They have not yet been able to back this up with the microbiological findings, which is of concern that the source may still be out there, although they are giving advice to avoid these food items until further notice.
And presumably once they are, or if they are able to say this is the batch of salad or whatever it is that the E.Coli comes from, then they can begin to really get on top of the outbreak.
Well, they have issued advice to avoid the implicated food items, so hopefully cases will start to reduce soon.